Our top story this morning is the GOP coming together to push their health care bill through the House. Congressional Republicans one step closer this morning to repealing and replacing Obamacare after narrowly approving a bill yesterday by a vote of 217 to 213. Now the measure moves on to the Senate, where the president is certain Republicans will stand united. Watch.
The groups have all come together. We have the Tuesday group. We have so many groups. We have the Freedom Caucus. And they're all great people. But we have a lot of groups. But they all came together. We just have developed a bond. This has really brought the Republican Party together.
Joining us right now is townhall.com political editor Guy Benson. Guy, good to see you. Thanks so much for joining us.
Hey, good morning.
So is that what happened, you think? The GOP did come together? I mean, Democrats are still in disarray. They're struggling to find a clear direction for their party. What's your reaction to the political drama, and how are you feeling post this House vote?
Well, the Democrats did all come together to vote against this bill, as did 20 Republicans. But, yeah, getting this step done was a real, maybe, turning point. It's too early to quite tell that for sure, but it was definitely an accomplishment unto itself, politically speaking, because, remember, you had different factions of the Republican Party, Maria, that were all over the map when it came to what to do about Obamacare. They all agreed Obamacare is bad. The numbers speak for themselves. But on the actual governing task of replacing it, that was a much different story, and it took a failed vote, a big embarrassment in March. Technically, they pulled the vote, and then some cajoling and some negotiations behind closed doors with the Tuesday group, with the Freedom Caucus, and eventually they get just over the line at 217. They needed 216. And now, to me, the whole thing is advance the ball. Move this process forward to the Senate. There are going to be, I think, significant renovations on this bill in the U.S. Senate, but the key is getting it there, because that was not necessarily clear it was going to happen.
So do you think it's going to be as sort of contentious a fight in the Senate as we just saw in the House?
It very well could be. The one thing I would say is the Senate's been hanging back and watching the House for a while, so they have a sense of what is in the Republican bill that just got passed out of one house. They also know that their members have a different set of priorities. There have been some more moderate folks in the Senate that have come out and said, look, we want a more gradual change in the Medicaid expansion reform in the bill. We're concerned about people aged 55 to 65 and some of their premiums going up and perhaps some additional help on tax credits. They have some specific objections within the bill. Meanwhile, you've got the other flank of the party, the Ted Cruz's and Mike Lee's and Rand Paul's of the world, who are going to want to be tugging things back in the direction of, say, the Freedom Caucus. So some of those same dynamics exist. The only thing I would point out, Maria, is because of the backdrop to all of this, which is a reconciliation bill, which is that budgetary tactic, because of the rules on reconciliation, there have to be unlimited amendments to the Senate bill. Anyone in the Senate can offer an unlimited number of amendments, so we're going to see what they call a vote-a-rama on this thing before anything might pass, which is why I think it's guaranteed changes are coming.
Wow.
Guy, I'm curious, one thing we've talked about on this program, and even the Wall Street Journal editorial page touches on this, that this was an incredible feat even for President Trump, where he was working on this in the House vote by vote in terms of him lobbying and cajoling. However, to the American people, the Republicans have yet to message what this does for our health insurance system and for our health care. A friend of mine, a well-known Democrat who I will not name, put on her Facebook page yesterday, the sickest, poorest, and oldest suffered today with this vote, which is a patent lie. The oldest still have Medicare. The sickest and the poorest still have Medicaid. But again, the Democrats are ahead on the messaging.
Yeah, and children still have S-chip. So there is definitely some hysteria here about how this bill sentences people to death. We've seen a lot of that. And look, there are studies that show that the death rate post-Obamacare in America has gone up. Now, if I were a hack, I would say Obamacare is killing people. But I'm not a hack because there are other factors at play there. But it seems like the messaging on the left is this is a bill that doesn't help anyone, is going to kill everyone. I think the Democrats overreached massively in their promises for Obamacare. They said it wasn't going to hurt anyone. It was a win-win for everyone. Turned out to be a series of major lies. Now they run the risk of overreach in the opposite direction. Look, I think there need to be some changes and improvements to the Republican bill, but What the Republicans are saying is Obamacare is falling apart as it is, and it's not working, and it's going to get worse. We promise people who are being harmed by Obamacare that we're going to help them, and the key is offer a better environment for insurers where they can offer more plans, some of which are going to cost less money, that will help a lot of people and entice more people into the risk pool, into the market.
So do you think people believe it? I mean, what Dagan's saying, it's across the board. When you look on Twitter, Facebook, you know, so many Dems are out trashing this bill, and they're talking about morality, aren't they, Dagan?
They're making it a moral issue that Republicans are trying to kill you.
Right, exactly.
But to that point,
I mean,
and Guy, you can disagree with me. I think Republicans were at the risk of having to own the collapse of Obamacare if they didn't do anything.
And now they're,
because these insurance companies in June and July have to present their plans for next year to the state insurance regulators. So if the Republicans didn't act, then they were going to own the collapse of the Affordable Care Act.
And now they're trying to act like, you know, they're calling it Trump Care, is immoral. I mean, Hillary Clinton is launching a new anti-Trump political group, Guy, as early as next week. This group is going to be called Onward Together. It's reportedly founded with the help of Vermont Governor Howard Dean. What is Hillary Clinton fighting against here? I mean, it's as if the Dems still are not listening to the American people.
Yeah, Onward Together sounds very similar to Stronger Together, a slogan that famously worked so well for Hillary Clinton. That's what we need, is more Hillary Clinton, I think, in our politics. I'm sure the Democrats would all agree. I wonder if they're going to launch this political action committee in Michigan or Wisconsin. That might be a good move on their part, since those are states Hillary Clinton decided didn't matter during the presidential campaign. Look, I think that this actually might be a good move for the left, so long as Hillary Clinton isn't in public ever talking about it. She's very, very good at raising money. She doubled Donald Trump's fundraising and spending. She's a money-making, money-in-politics machine. So if she's going to raise a bunch of money for left-wing causes, she'll be good at that. The problem is if she comes out and tries to communicate it to Americans, which reminds people exactly why she lost.
Yeah. I wonder if George Soros is involved in that. Probably his money's there, too, right?
Yeah, well, money in politics is a terrible thing, Maria, unless it's liberal money in politics, which is a wonderful thing.
Yeah, Hillary raised
80
times the amount of money from the securities industry that Donald Trump did. Carly Fiorina and Scott Walker outraised Donald Trump in terms of Wall Street firms.
It didn't help her, Dagan. It didn't help her.
Again, I think the number was like north of $80 million, something like that. It was insane.
Wow, that's incredible. Guy, great to see you, sir. Thanks so much.
Thanks.
We'll talk with you soon.
Good morning.
Guy Benson joining us there. Coming